Insights still to come on our program. Recent spikes in U.S. coronavirus infections, as many as 50,000 a day, worry public health experts. A word with the editor of the New England Journal of Medicine right after this break. Welcome back. This is World Insight. I'm Tian Wei. COVID-19 spreads virtually unchecked across the United States. Johns Hopkins tally showed almost 100,000 new cases over the weekend in the U.S., and the total confirmed cases surged over 3 million. Florida has reported the daily highs of 10,000 new cases. Arizona has seen record hospitalization. Countless Americans joined the festivities across the country. Health experts fear in 5 to 7 days there will be a new spike in cases. Donald Trump and Joe Biden have both made the pandemic a top campaign issue, and Trump's campaign team says it will hold another rally this week. That's despite criticism from health experts of previous election events, as some Trump staffers later tested positive for the virus. Well, many states are gradually reopening their economy. It was a daunting challenge for some that opened too quickly. What's the public health prognosis in the U.S. now? Earlier, I talked to, in an exclusive interview with Dr. Eric Rubin, the editor-in-chief of the New England Journal of Medicine. He told me a lack of leadership left the states to fend for themselves. And I'm joined by Dr. Eric Rubin, editor-in-chief of the New England Journal of Medicine. Dr. Rubin, what a pleasure to see you.
Nice to be in touch again.
I know Boston is doing much better than last time we were talking. So tell me more about where you are and how situations are.
The number of cases and the number of resultant deaths has declined substantially in Boston, and in fact around all of the northeastern states in the United States. And that's allowed a gradual reopening of the economy here.
I see a divide almost in terms of results of the last few months among different states and cities. So how should we understand the various degrees of achievements? And some states, though, are not doing well at all.
That's right. In the United States, public health is largely driven at the state level,
yes, not
so much at the federal level. And particularly now, where the federal government has not taken a very strong leadership role, I'd say, it's left it up to the states to decide what to do, and states have set their own policies. On top of that, there are different degrees of buy-in, I think, from the populace in different places. In the Northeast, where we've had a very severe outbreak, people understand that the disease is a problem, and they have largely kept with guidelines. But that's been a little less true in other parts of the country, which hadn't really seen much disease in the earlier phases.
Dr. Anthony Fauci, in a recent interview with National Public Radio, admitted that it was a mistake earlier by the public health officials not to support the public wearing masks, and even suggest the other way around. Even though now, in retrospect, the public health officials said they made those statements only because the masks, particularly masks that professionals could wear, were limited at the time. This is a very interesting story, but certainly a story that could cost lives.
The failure was to communicate the clear message, not the simple message, but the real message, which was we were not certain of how well cloth masks would work, and we thought that the highest priority was for healthcare workers to have masks. But somehow that got translated into the general public shouldn't wear masks at all, and only healthcare workers should wear them. Obviously, there's a contradictory message. Why, if they're important enough for healthcare workers to wear, shouldn't other people be wearing them? Yeah. And I think that they were trying to strike a balance and probably missed on the messaging.
Time is precious. So how should we see the public debate? On the one hand, the thorough knowledge that people need to have and the rational choices they need to make, and also the public health officials articulating all the messages vis-a-vis the precious time that we are running against in order to save lives, particularly looking at the U.S. situation, about 50,000 new cases every day now.
I think there are two issues here. One is what we talked about, is how to properly message so that people can understand. People are smarter than we give them credit for, but they're trying to think through these issues, and I think that we have to provide them with accurate information, not just a bottom line, but how did we get there? What is the rationale for doing what we do?
Yes.
But clearly, we need political leadership as well to communicate that message, and we have, I think, had inconsistent messaging at the level of our political leaders.
From a public health perspective, do you think the federal level should play a bigger role now?
Look, whatever mistakes were made in the past, there are still plenty of room to fix them. And I think a lot of that responsibility does fall on the federal government, in part because the states need that leadership, and also because there's a lot of political gamesmanship around what's really a deadly disease. And it would make it far simpler for states to toe a line if a sensible one was being advanced at the federal level.
Whether the U.S. is having the danger of eventually going to herd immunity without a vaccine, which could mean huge loss of lives, if you look at the current growth rate and the current growing trend.
Well, it seems like it's going to take a lot to get to the level of herd immunity. I don't think we're close to that yet. And one of the striking things right now, and we'll see what happens, is that in many of the states where there's a large increase in case rate, it's happening in younger people, and they're the people who are much less likely to die of disease. What that means to me is that it seems likely that older people are practicing social distancing, are staying at home, and so I think that the message is varying for people who are more concerned about their own health and people who are not so concerned that they'll get sick. So I think it's possible that we could get a lot of disease with fewer deaths because of the demographics of the people who are not taking such strong precautions.
What if there were a second round, and what if there were even a third round? How do you see those possibilities and the danger those could mean for us?
In the U.S., it never went away, and there doesn't, unless things change, there's no prospect of the disease going away. So, and it's going to continue, at least at a low level, hopefully at a lower level than we're at right now. So I think I worry about the disease not going away in places, because if it doesn't go away in some places, it's going to come back in others. So calling it a second round or a third round isn't really helpful. We've got to get rid of it everywhere. And that's why what's happening in the U.S. matters to you in China, because eventually it'll get back to China if we can't control it here. And the same goes for any country where there are outbreaks right now. They spread. It's an infectious disease, and it doesn't know to stay in a country. So we're going to continue to have problems as long as we can't control it in places.
We have to deal with a new normal, a time we have to learn to coexist with the virus, and it may take quite a while. That was said to me by Dr. Eric Rubin from the New England Journal of Medicine. So is the vaccine, though, I asked him, the only light at the end of the dark tunnel? What is the latest on the making of the vaccines, and how will they be delivered? I asked Dr. Rubin about these questions. Take a listen. In your journal, New England Journal of Medicine, recently have been articles about asymptomatic, the percentage of asymptomatic, and their relations to the so-called pre-symptomatic, meaning actually eventually become symptomatic only at the time of the tests. The symptoms were not very obvious. So how should we understand these increasing numbers of concepts and concepts that we do not know thoroughly? Are you satisfied, Dr. Rubin, about the speed of our increasing knowledge of this virus so far?
I think that we haven't gotten a good handle on the ratio of asymptomatic to symptomatic disease. And just now studies are being done. We haven't really published any of them yet, but I know that there's information coming out there about how many people are asymptomatic. It's a relatively simple thing to test for, but it costs some tests, and that's not, we are still limited in testing in the US. In other countries which have fewer limits, it's going to be easier to tell. But in order to tell that number, you have to have a sufficient amount of disease and a sufficient number of tests to do surveillance, to use them for surveillance rather than just for treating patients. I think we are making progress in figuring out what the therapies of disease should be. And in particular, clearly the death rate appears to be dropping. It's dropped considerably since the initial outbreak in China. It's varied considerably from country to country, but I think that our supportive care has gotten much better. Our specific therapies are a little behind that, but they're people working toward that. I'd also add that the pace of vaccine development is incredibly impressive. I don't know that it means we'll end up with a vaccine shortly, but there is a huge amount of effort.
Let's talk about the treatment a bit, especially combination of treatment. Remdesivir, for example, which is being considered as one of the medicines that could help with the process of particularly curing the severely diseased, have been, collected and bought by the United States, mainly, and the price is really gigantic, given the ordinary price of medicines of the same category. So, Dr. Rubin, how should we see the interests within border and the interest globally, particularly with something called infectious disease, which is a global one?
Remdesivir is a special case, and I think it should, of course, be broadly available across the globe. There are issues with remdesivir. Number one, it doesn't appear to be that good. So it's not a miracle cure for anything.
No.
It will be useful for people who are the most sick. But unfortunately, it doesn't look like a tool at this point that's going to help us control the outbreak. All it's going to do is, we hope, save some lives. And we haven't even proven that yet. But that it looks encouraging for saving some lives. But it won't be the public health tool that we need, or at least not at this point. And then it's just recently approved in the U.S., and there isn't very much of it. And so the questions of how it gets allocated are substantial, both in the U.S. and should it be made, as it should be, available internationally there, because there just aren't going to be that many doses available. So right now, it's not the solution. It's a tool and one of many. But no question, it and any other therapy that made a difference should be more broadly available and should be thought of as a world resource rather than something that a single company owns. We have invested, the U.S. government, has invested a large amount of money in developing this drug and paying for clinical trials. And we should be using the leverage we have because of that to make sure that it becomes available.
So you are suggesting, Dr. Rubin, that it is about national border as long as the specific country invests in certain things, and it should have the priority or the precedence in a way in having ownership of it, and therefore it's not global public good. Is that what you're trying to say?
Oh, no, not at all. I'm saying that in part because of the investment that we've made in that drug and almost any other drug that's developed, they should be seen as a public resource. Not a U.S. only resource, but a public resource. And we should be thinking about how best to use them rather than how best to make money off of them.
China suggested through the country's president that it will become a global public good, quote unquote. That's exactly what he said. We haven't seen pledge of that from any other country of the world or any other organization of the world. So how should we see the quite challenging reality we're facing right now if there were any successful vaccines?
I agree with the sentiment. It's vitally important that any vaccine be made widely available. And not doing so is counter to the interests of any individual country. It's not as if countries exist in isolation now. If there's an outbreak in Cambodia, it affects China. If there's an outbreak in Mexico, it affects the U.S. We have an interest in making sure that that infectious diseases which don't respect borders are controlled everywhere. So I think it's in everyone's interest that vaccines be widely available, and it's also the right thing to do. It's the ethical thing to do.
But to prepare in advance, that's the point, isn't it? That's why CEPI, Gavi are existing. They are supposed to establish platforms, and so are the latest platforms by the Gates Foundation in cooperation with the WHO and things like that. So so-called accelerator in a way. This is about that.
I think that's right. And I should say that CEPI and Gavi have had the participation of most of the major pharmaceutical companies. So they do buy into the idea. This is a little more complicated because many of the players in this vaccine space are small biotechs. They're companies that don't have the experience of producing a global vaccine in the past. And it might depend on who produces it, but I think that there is an impulse among many of the vaccine developers to make it widely available, even if any particular government is not so supportive of that idea.
But we see that with the swine flu, for example, with all kinds of diseases. In fact, many of the diseases humans have, with my little knowledge about public health, is a lot of them originally are coming from the animal world to the human world. Well, you could also argue we are actually part of that world anyway. So if we exclude those opportunities, actually we could only live, some could argue, in vacuum. So that is about how we can coexist with the reality like that, but at the same time taking better care of ourselves. But how would that be done? That is probably the most gigantic question the public health community around the world need to face right now.
I think there are a couple of answers to that. One is that we should be careful about what sorts of interactions we have with animals, particularly wild animals, because a lot of the new severe outbreaks like this one come from animals that we don't ordinarily interact with, probably. And if we're going to interact with them, then we've got to be careful about keeping them caged, keeping them around people. We really want to think through where do the risks occur. With influenza, which is our longtime nemesis, we know that that's an animal virus. We know that it's going to come from animals. The best thing we can do for that is anticipate it. And anticipating it means surveying the animals, which is being done particularly in China, and looking for new viruses arising and being prepared should those cross into humans. And that's really important. I think we were not adequately prepared for another coronavirus crossing over. We should similarly be prepared for the next coronavirus outbreak.
We have seen our world being transformed, like it or not, into a very different style. Different style of living, different style of interacting, different style of working. How much do you think we have been transformed, and how much is there to come?
I'm a big believer in medical progress, Tian Wei. I think that we are going to have vaccines. I think we're going to have more, I'm hopeful, more effective therapies, but I'm very hopeful, very optimistic about vaccines. and that those will allow us to get back to the old normal, not some new way of living. I think we're going to get there. It is going to be some time, and I think we have to have some patience rather than expect miracles around the corner.
And that's all the time we have for today. If you'd like to see more, you can certainly search World Insight or check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei on behalf of the team. Thanks for watching.